Hi, this is Dr. Joe Ross and Dr. Desai, and we're here to talk to you about pediatric eye care, which means caring for your kids. And the reason we're doing it is you can see Jay is shorter than me. He's obviously the kid, and I'm obviously the parent. Well, maybe that's pushing it. But you do have kids, don't you?
Yeah, I got a 20-month-old and a 5.5-year-old boys, so...
Is one of them in school yet?
Yes, the older one's in kindergarten.
Okay. So, well, my question is, what do you do about them to make sure that they have normal vision development? They're not losing out on an opportunity to succeed.
Good question. Number one, when a layman, thinks of a child having a lazy eye, it's one eye's cocked eye, a little bit strabismic, or drifting apart. But we know that's not the case. Sometimes, if one eye has an unusually high prescription, or both eyes have unusually high prescription, the brain, the visual cortex, is not getting good quality vision.
Wait a minute. So this is like your cable not working on your TV and you're not getting the signal?
That's right. Or you're getting signal.
Do you call Comcast?
Yeah, it's a poor signal.
Okay.
So, so I've seen many children with, unusually high prescription one eye or both eyes, but the parents never thought about wondering they have a lazy eye because physically the eyes are straight. They're not cockeyed.
They're not going like this or like that.
No, no.
So they can have a problem without having an obvious one.
That's correct.
But what happens if it's a little farsighted and it's not crossing? Why should they be concerned?
Well, our concern is if you're not getting good quality vision as an adult, when they start to learn to read the letters and read the eye chart, they may not be able to correct to see 20/20.
Wait a minute. So you're saying that because they didn't use the eye, it doesn't see so well?
That's correct.
So if I tied your hand behind your back like this. Oh, sorry. And you didn't get to use it till you were about 12 years of age, and I said, here's a ball, go throw it. You wouldn't do that well?
No, I would stink at lifting weights.
Well, we're throwing balls, not
throwing
lifting
balls,
weights.
yeah.
All right. So basically you're saying that you think your son at 5 needed an eye exam. Or should have had one.
Yes.
Did you give him one?
I did.
All right.
Yeah.
So is that what you're recommending for our patients out there?
That's right.
Now, why would they go to a pediatric optometrist rather than anywhere else? Someone like yourself.
Good question.
It is a good question. I asked it.
Because we're not only concerned how they do see far away, but how they read up close. Because if your eyes don't coordinate well when you read, it's going to impair your reading skills, your education, and at least we can give you solutions.
But what do we do that's different than someone else might do?
Well, we do extensive near-point testing. We check their eye muscle coordination to see whether their eyes drift in, they drift out, and we can determine whether vision training, if their eyes drift apart when they read.
Vision training. Is that something that we do uniquely and very few doctors do?
That's correct.
So we do something to help the kids get their eyes to work together that can avoid having glasses entirely?
Sometimes, yes.
Cool. Well, maybe that's something we should share with. I think we just did.
Yeah.
All right. Well, that's enough information. We don't want to get everybody overloaded with stuff. So, as Jay has done, get your child's eye examined. And where should you do it? Well, Jay did it for his child. Yeah. Bring him to Jay. He's had at least one experience that we know about. Well, probably a lot more.
Much, much more. I'm not a newbie.
Thank you for listening to us at Holistic Vision Care. Have a great day.